Hello, I'm Kim Hauck, the Director of the Ohio Department of Developmental Disabilities. Welcome to the annual DODD training provided for County Board members. I want to start this training with a message of gratitude. Thank you so much for your commitment as board members. Volunteering your time and choosing to use your expertise and passion for County Boards of Developmental Disabilities is appreciated. As I record this training in March, Ohio is in the midst of the biennial budget process, and DODD is nearing the end of our 2-year budget cycle. I'll spend our time here providing updates and reviewing progress made through the DODD strategic plan and our shared efforts. At DODD, our mission is to partner with people and communities to support Ohioans with developmental disabilities and their families in realizing their version of a good life. We envision Ohio as the heart of opportunity and the best place in the nation for people with developmental disabilities to thrive. Our budgets, strategic plans, key initiatives are all focused daily on that mission and vision through the values of partnership, inclusion, and respect. The Ohio Department of Developmental Disabilities Fiscal Year 2024-25 Strategic Plan focuses on 7 key components of charting the life course: to support families, integrated supports, advocacy and engagement, safety and security, healthy living, daily life and employment, and community living. Across those 7 key areas, DODD has 5 key initiatives: empowering Ohioans with developmental disabilities through active participation in policymaking, decision-making, and person-centered planning, ensuring that Ohio's youth get the support they need at the right time to put them on a strong path to a good life, enhancing the DSP workforce through addressing wages and supporting providers to ensure that everyone has the support they need, demonstrating how technology can allow for more independence and a better quality of life, and redesigning Ohio's DD waiver system by modernizing processes, encouraging excellence in adult day and employment services, and learning from the positive changes made over the past few years. Ohioans with developmental disabilities and their families should have every opportunity to be a part of their communities. People with disabilities across Ohio have led this effort and advocated for communities to be accepting and inclusive. At DODD, we have worked with advocates to ensure that every county board of developmental disabilities will have a board member with developmental disabilities. Thank you, board members, for your support and inclusion of this effort. It has been truly remarkable to see the number of board appointments this past year and learn more about the new board members and their stories. This is a strong collective signal to our value of inclusion and giving people input over the decisions that impact their lives. DODD is continuing this work through supported decision-making. Supported decision-making is a framework for people with disabilities to be able to make their own decisions about their lives, education, employment, healthcare, and legal areas. This approach builds on providing information, skills, and guidance to make decisions in areas where support is needed, just as any of us would seek out our friends, families, and supporters when we need advice. Adding supported decision-making respects the use of guardianship while adding an additional important option for Ohioans with developmental disabilities. To embrace this change, we have worked with partners on resources, many of which can be found on our website. We are also working to make changes in Ohio law. Significant effort this past year has led to Ohio being the national leader in adopting the use of universal changing tables. For years, families have worked in local communities and statewide to advocate for these tables. Through the state fiscal year 2024 and 25 budget, DODD was able to dedicate a significant amount of funding to county boards for accessibility projects like universal changing tables. Your boards truly answered the call. You have worked extremely hard to plan for these dollars, get community support, raise awareness, and complete projects in a short amount of time. Governor DeWine's administration has worked collaboratively to support youth with complex needs and their families. DODD continues to find great value in providing flexible funding to county boards. This funding, called Keeping Families Together, or KFT funding, is aimed at supporting youth with complex needs and staying in the family home. These funds are allowing local communities to identify needs and solutions that work for them. DODD plans to continue this important funding option in the next 2 fiscal years. Over the next 2 years, we will continue to work on building the capacity and expertise of ICF and waiver providers to keep families together, to provide interventions early, and to provide necessary residential options. Governor DeWine's budgets have addressed the most pressing issue in our DD system, the availability of DSPs for Ohioans with developmental disabilities. Ohio's DD system has struggled to recruit, retain, and invest in the essential workforce, primarily due to low and unmaintained Medicaid reimbursement rates. People with developmental disabilities, their families, and provider agencies are exclusively reliant on Medicaid rates to compensate DSPs. When Governor DeWine took office, rates supporting wages for DSPs were an average of $11.12 an hour. Through Governor DeWine's and your actions, Ohio has made a monumental commitment. Building off state fiscal year 20 and 21 investments through the state and county boards of developmental disabilities, Governor DeWine's fiscal year 24-25 budget invested a historic $1.3 billion between local, state, and federal funds into provider rates so DSPs could get paid more. The fiscal year 2024-25 budget included increases across the board to waiver and ICF providers. We again thank boards for their partnership and fiscal commitment to realize these investments. Early estimates for July 2024 indicate the average starting wage increased to $16.04 per hour, with an overall average wage of $17.04 per hour. We expect, with full data, to see an average DSP wage across the state of at least $18 per hour. Providers have reported to DODD that many are fully staffed for the first time in years, and they are seeing lower turnover. This allows them to increase the number of people they are supporting and the amount of services offered. DODD has posted the early data from the historic rate increase on our website. People with developmental disabilities and families have also reported the positive impact of increased wages. On behalf of DODD, the people we support, their families, our providers, and our county boards, thank you again for the role county boards play in those rate increases. Technology, from off-the-shelf assistive items to remote support, allows for greater independence and quality of life for Ohioans with developmental disabilities. Funding initiatives to promote innovative technology and using technology through waiver and ICF services continues to be an important initiative at DODD. In this past year, we have established regional technology support, creating close-to-home opportunities for people to experience and try technology that may benefit them. Regional teams that provide technical assistance for the county boards and providers who want to offer the service or learn more about how it can increase the independence of the people they support. These investments are giving more people across Ohio the opportunity to explore and use technology in the way it works best for them. The DODD home and community-based waiver system is almost 20 years old. The system needs to be updated to better meet the needs of people with developmental disabilities and their families. To achieve this, DODD is working with partners on the Waiver Redesign Initiative. In this past year, we have made permanent an option to support family caregivers of minor children who have extraordinary needs. We also have improved the shared living option to provide additional support for the person receiving shared living while giving more flexibility and assistance to the caregivers. One key part of the Waiver Redesign Initiative is a project to review and update waiver assessments and reimbursement systems. In the next year, we are working with stakeholders to review our assessments and to move into a new direction with a goal to help all involved, including to leverage technology and streamline service planning by incorporating information from assessments into the discovery assessment process, to make assessments more accurate to a person's needs to identify an assessment tool that can effectively identify the support needs, to simplify billing by incorporating acuity-based rates for some services such as homemaker personal care. Acuity-based rates will compensate providers in a manner that is consistent with the support needs of the person served, eliminating the need for service rate add-ons. I hope this gives you a sense of what we are working on over the next year at the Ohio Department of Developmental Disabilities. More in-depth training on many of these topics can be found in the additional DODD training. Thank you again for participating in this training and for your dedication to supporting people with developmental disabilities. I look forward to working with you and all of Ohio's county boards in the coming year.